Serious, doctors of Reddit. What was your worst? I don't think this is important. But patient? Had a male in his 50s walks into trauma to have his left thigh stitched up. Not an uncommon wound in an agricultural area. Speaking to him while stitching him up, he tells me he fell off a ladder while cutting a branch and the machete sliced him on the way down. Told him I was going to write him up for an x-ray of the entire leg just in case. He kept on saying he was fine. His knee hurt a bit, but logically that was from the fall. I agreed, but asked him to go to the x-ray department just in case. He reluctantly walked there and back. X-rays showed a helical fracture almost the entire length of his femur. Besides being a dangerous fracture, the femur is supposed to be the most painful bone to break, and he was walking around. In the end, had to show him the break to get him to sit down on a wheelchair and into the hands of orthopedics. That man's pain tolerance still impresses me. Everyone at my company knows the story of the patient who came in for genetic counseling, went through their whole family history with the counselor, and then concluded with, "Oh yeah, I was adopted as a baby and don't know who my birth parents are. Does that matter?" Me. Any prior surgeries? Patient. No. Me. Examining them. Did you know that you only have one testicle down here? Patient. Oh yeah, I had one cut out. I always asked specifically about gallbladder, appendix, and testicles because patients forget about having a fucking organ cut out. Me. Do you have any medical history, including things like heart attacks, strokes, high blood pressure? Patient. No, nothing ever. Me. So why do you take list of heart meds? Patient. Oh, I've had multiple cardiac arrests. One of my first patients as a medical student, we were asking her about prior medical history. BC, she was in a wait list for an intestinal transplant, and we asked her in every possible way if she had any history, and she was like, "No, I was very healthy before this." Finally we ask her, "Do you take any medications at home?" And she goes, "Oh, just the meds I take for the lupus." Had a patient come into the ER with some sort of spider/bug bite on her hand that had progressed to a red line running up her arm. She stated she put Benadryl cream on and it was very itchy. We continued talking and I asked if she had any allergies. "Yes, Benadryl." I thought, good lord, WTF, and I'm sure it was reflected on my face. We washed the Benadryl cream off her arm and miraculously it stopped itching. Had a guy in his 50s who had been seeing an acupuncturist for an area of numbness and weakness traveling down his legs. He'd had 2 months of acupuncture for them with no improvement, so very reluctantly booked a routine GP appointment. At that point he'd started to have issues with his urination too. As soon as I started speaking to him, it became obvious that the symptoms he presented with were consistent with spinal cord compression, an absolute medical emergency. We got him straight into hospital and imaging showed cancer, with a tumor pressing onto his spinal column. Although he started treatment and steroids that day, by then it was too late. He lost the ability to walk and died a few months later from the cancer. It was enormously sad and frustrating, as that constellation of symptoms would have raised an immediate red flag with anyone with medical training. Had he come in months earlier, maybe his prognosis would have been quite different. This 20s guy came into the hospital. He had a lot of conditions where he wouldn't make it past 40 and he currently had some infection. We kept giving him antibiotics which helped, but not as much as we would have liked. After about a week of being in the hospital, I walk in and I'm talking to him and he tells me that he got a medically necessary circumcision on his last admission to the hospital. I ask if it's okay if I take a look to make sure it's healing okay. It was black with all kinds of infection. I'm just not sure how a 20s married man, or his wife, never thought to tell anyone about this for the past week. I had to take out the remainder of this guy's teeth. He was in his 60s and told us verbally and on his health history that he didn't take any meds. So I took out his last 8 teeth. All easy extractions due to infections and periodontal disease, but I couldn't get him to stop bleeding. I asked him again if he was taking anything. I finally got the clot stabilized, but it took almost an hour and I had to consult our oral surgeon. When he saw the oral surgeon a few months later about placing implants, he told the oral surgeon he was on BP medication and blood thinners. I refused to see him anymore after that. I once checked in a guy and asked him if he'd had any previous surgery. No, never. When I examined him, he had a surgical scar from just above his pubic bone to just below the sternum. "What's that then?" I asked. He stared down at it and said, "I've never noticed that before. WTF? Question mark, question mark, question mark." I was an internal medicine resident who had a patient come to my clinic for persistent flu. I had never seen her before, and she was a healthy appearing woman in her 60s. About a month before seeing me, she was seen by her PCP with persistent coughing, and otherwise had no shortness of breath or other infectious symptoms. Just a dry cough. She got tested for flu and was negative, but got Tamiflu just in case it was a false negative. She had a chest x-ray which was normal. She came to me a month later because her cough persisted despite completing her therapy. Everything sounded great. Heart, lungs, everything. To be honest, I don't usually do this, but something in my gut told me to feel for lymph nodes. I felt around and found something above her left clavicle. It was hard, round, and she was completely unaware of it. I told her it was probably a reactive lymph node, but just in case, I wanted to get an ultrasound. This cascaded into her getting a biopsy, which showed squamous cell lung cancer. A CT scan showed stage 4 lung cancer, not seen on her chest x-ray. All diagnosed because of a lymph node that almost by chance I was lucky enough to find by being thorough. I checked her chart about a year ago, and she was doing well. She got therapy and was in remission after a very long road and many obstacles. I'll never forget her or her case. Intercepted a young woman who was just hit by a car. Her boyfriend was standing with her freaking out. I do a basic physical exam and get a history, and make her comfortable as we wait for the ambulance to arrive. Once the ambulance arrives they ask for the same information, except this time the boyfriend mentions he was the one who was actually hit by the car and was shielding his girlfriend's body. The entire car's windshield was cracked by the impact of his back. He was just freaking out and worried about her, and was in shock and hadn't begun to feel any pain yet. My anxiety attacks are less frequent since I started on the new medication, and moved into my new place. It's much larger than my old place. The bathroom where my dad would rape me was so small. So, claustrophobia and anxiety and… Alright, give me a second to unpack this motherfucking payload you just dropped like a bomb into the space between us. Final edit. I can't revisit this comment anymore. I'm sorry. If you need help, I am here for you and will do what I can. Responding to comments today brought back too many emotions and I need to check them here and leave them be. The memory is not a good memory in my mind. It does nothing but upset me. Apologies to anyone who posts and doesn't get a response past this point. I'll probably delete it after a time when I'm confident enough that it isn't a window for those who need help to crawl through. We have to feel your pain to understand it, and this one hurt badly. I've endured it again for the day, but I must quit it before it guts me again. Emergency radiologist here. I see plenty of people presenting with understated symptoms that turn out to be mind-blowing advanced disease. The saddest one was probably the 4-year-old boy who presented with a rigid abdomen for a few months. Was told by their pediatrician it was constipation months ago, but his parents never followed up when it didn't resolve. When I imaged his abdomen I found his entire liver was replaced with a mass consistent with hepatoblastoma. I asked the parents why they waited so long to work it up. They said they were satisfied with the diagnosis of constipation. That one left a mark on my soul as a patient, but this is too fresh not to share. I'm 32 and at work Friday morning, as in 2 days ago, I started having pain in my lower molars around 10:40 a.m. It eventually got so bad I left work and went to urgent care, noon. I thought it was a gum infection and I'd get some antibiotics and ibuprofen and be told to see a dentist or something. I had to keep apologizing to the intake person because I was stumbling over my words, unfocused because of pain. When the urgent care doc came in, 1 p.m., she talked to me for about 30 seconds before peeping in my mouth and saying my gums were fine, then checking my eyes with a flashlight and calling an ambulance. By the time I got to the hospital, 2-ish, I was basically nonverbal and my attempts at texting had become disjointed. My spouse met me in the ER after a CT scan and helped me consent to an 4-clot buster, DPA at about 3 p.m. I'd had a stroke. For those doing the timeline math at home, yikes, good news. The TPA worked very fast and I'm hopefully getting discharged tonight. I owe that urgent care doc a thank you note. While pregnant with me, my mom was wrapping up an OB appointment. The GYN had already left the room. Mom was gathering herself to leave and mentioned to the nurse her contacts were messing with her. She had spots in her vision. The nurse stopped and asked her to sit down. Brought back in the GYN, who had her stay and deliver me via emergency C-section. Without anyone knowing it, she had spontaneously developed preeclampsia and her blood pressure was rocketing sky high. She was dangerously close to having a seizure, and that would have been that if she hadn't mentioned the spots in her vision and just left as the appointment was over, or the nurse didn't listen. Was called to the ER to do a psych consult on a patient that was complaining of GI symptoms, but his story was sorta strange and he had no overt abdominal signs or symptoms. He was complaining that he suffered from Barrett's stomach, not esophagus, and had been diagnosed by a world-famous gastroenterologist. He stated that if he could lose weight that his GI issues would resolve. I spent some time talking with him and, other than this strange fixation on his Barrett's stomach, he seemed okay. Until he mentioned that his most recent weight loss method was to shoot himself in the thigh so that the leg would become gangrenous and eventually need to be amputated. This would allow him to quickly lose the 20 or so pounds needed to cure his stomach ailment. The man actually had a self-inflicted gunshot wound to the thigh from several days before. I didn't actually assess the wound because I was there for a psych consult, but did immediately alert the ER staff. I was all calm and nonchalant, like, "Oh sir, excuse me for a second, I'm gonna pop out and let another staff member know about this so they can take a look at it for you." The ER was located in a county that employed a staff of mental health social workers to place psych patients, so I had to call one of them out while he was getting thoroughly physically assessed. I have no idea what happened to him, but I hope he's doing okay. Quite common in Malaysia since some health products escape notice from the government. I don't think this is important, but have you been taking supplements for weight loss, or do you have an exam coming up? Young women coming in with severe palpitations and crazy arrhythmias, usually healthy, no prior health issues, and are usually at the age where they're in college or university. Initially most people would be thinking thyroid issues, and a fair few have been treated this way. Then I realized they've been taking caffeine supplements to help with weight loss/increase concentration. Specifically, some brands off-label only put it in between the fine print of the product ingredients, usually in near lethal quantities. Lol. When I was in my final years of med school, English division of a European university in a country where I speak the native language fluently, we were to do patient interviews and physical examinations on our own and then circle back to our supervisor. I was translating back and forth between the patient, infectious diseases department, and a fellow classmate whom I was doing the interview with. The patient said, "So you guys are coming in on a Saturday to do patient work? Good for you for going the extra mile." It was a Friday, which I initially brushed off as a mistake. My classmate asked me to ask the patient if he could tell us the date. I was like, "Are you sure? He's here for an infection, not head trauma. He might think it's a bit degrading." I thought it wasn't important, but she insisted, so I translated the question. Patient replies, "Ah well, it's 2002. Of course. It was 2018. After more questioning we realized all of his replies were all as if it were 2002, e.g. the last trip I went on was to Africa in the 80s. So about 15 years ago. As it turns out, he had neurosyphilis that went unchecked for many years. Did a bunion and hammer toe surgery on a lady with no allergies. New patient packet. Primary care note: all had no known allergies. I always ask about metal allergy anytime I plan on putting in hardware. Surgery goes great. I'm on call for the practice and receive a phone call for the group 18 hours post-op. Her nerve block had worn off and she was in excruciating pain. Give instructions on what to do. Next morning she is in my office before I even arrive. Intense pain. Sweating profusely. Blood pressure elevated. Foot is massive. Clearly not faking it. Have to send her to hospital for intractable pain. Blood work indicates elevated eosinophils but everything else normal. No blood clot or infection. Hospitalist convinced it's complex regional pain syndrome. I rack my brain and think of WTF could be going on. I am only 5 months out of residency. My butt is puckering so hard. Since eosinophils elevated, ask if she is allergic to jewelry. Thoughtful face. Thoughtful face. Yeah. My tongue swelled up when I had it pierced. I had it removed the next day. She had a freaking nickel allergy. No allergist will see her to confirm, so this is all speculation but makes sense with the hardware I used. Once the hardware is removed and exchanged for titanium, her pain resolved. There was one case in my residency of hardware allergy. 1/3000th cases I was first or second assist on. If I did not scrub into that case, I don't know if I would have figured this out so quickly. Crazy case. Now I always ask, have you ever had any reactions to jewelry? A lot of patients won't tell you about problems with jewelry and may not know they have metal allergies. Saw a dude in my ER once for a sore throat. He was coughing a bit when I went in. Looked in his throat and his uvula, hanging thingy in the middle, was just a tiny bit swollen but everything else looks okay. I asked about medication and he mentioned that he just started a BP medicine that had a nasty side effect of face and airway swelling. Long story short, we put a scope down his throat and saw swelling around his vocal cords and put in a breathing tube to keep his airway open. 5-year-old girl. At a pediatrician visit, her mother said she was acting loopy. A day later a scan confirmed a massive brain tumor in inoperable real estate. 3 weeks later I did her autopsy. Right before a craniotomy for a brain tumor. I was supposed to stop taking my Plavix? Oh, pick any of the patients who have put off a colonoscopy for a decade or two, then finally get convinced to come see me for it by their partner or family or PCP because they've been bleeding from their assholes for months. I also had a dude come in who had a skin cancer about the size of half a grapefruit growing on his back. Per him, He had decided it was just a fungal infection and was self-treating with Tinactin foot spray. I removed it and did a skin flap to close the spot. But he needed a follow-up to have staples removed. Never saw him again. Dunno if he still has the staples in or if he figured out a way to remove them himself, and neither answer would surprise me at all. While I was a psychiatry resident, I did a graded 30-minute interview on front of my attending on a new patient without knowing any previous chart history. I spent 29 minutes collecting high-yield medical and psychiatric history, and since I had an extra minute to spare, decided to ask him more about his childhood. Well, it was pretty shitty after I watched my dad murder my mom and then kill himself. Needless to say, I did not have enough time to unpack that and failed my exam lol. Me, I know my vision is a bit funny at the moment. I will go and get an eye test soon. Wife, after 4 weeks of me pulling my glasses to the end of my nose, enough. I'm booking you a test. Optician, yeah, something isn't right. Something is pushing into your eyes from in your brain. You need to go to hospital. I'll call them now. Phone call from hospital. While I'm in the opticians. Me, yeah, I can come in. But I'm taking my car in for a service on Weds. Will Thursday be okay? Them, okay? Turns out I had a brain tumor in my pineal gland that was blocking the normal exit of brain fluid. 3 surgeries and a round of radiotherapy later and it's 90% gone. My wife, the optician and the brain surgeon saved my life, because I was too casual to save it myself. This post is filling me with anxiety. Am pediatrician, newish mom there for 6-month-old baby. Baby cries. She turns and yells at the kid in her ear for being loud, turns to me calmly and asks how old they gotta be before you can give 'em a whoopin'? Had to perform an extraction. Took a detailed medical history. Patient said they were a diabetic and a hypertensive. Both a big contraindication in extractions due to uncontrollable bleeding. Unless they're meticulous about their taking their medicines and you stop the blood thinners 5 days prior to surgery. It's usually a bloodbath. I asked the well-educated, 50-year-old woman a number of times if she took her diabetes medicines on time and if she does at-home rapid tests to check her blood sugar. She said she takes them every day without fail and hasn't missed a day in over 2 years. She said she's super disciplined about her health and would tell me if she hadn't taken them. I sent her in for a rapid blood sugar test anyway, as a precaution, and lo and behold her values come back as 282 milligrams. Almost twice as much as the normal value, so it wasn't even like she was just off the mark. I ask her to explain and she gives a shocked expression and insisted that she took them. I ask her to physically show me her medicines instead of listing them out and she finally says, oh, I don't have it right now. I make it when I need it. She drinks bitter gourd juice on time every day instead of her diabetic pills because they are too big, and she 100% believed bitter gourd juice was the only medication she needs. She's a high school teacher. I don't think this matters, but I've lost 60 pounds over the past 8 months without diet or exercise. They thought it was due to moving to a warm climate from a cold one. If anyone that reads this is in the same boat, get to your doctor. That's a huge red flag for cancer. Edit, just to be clear, I wrote I in the first sentence to go along with the phrasing of the question. I do not have cancer. I work in the healthcare system and specifically with surgical oncology. When I say they, I was referring to the patient thinking they knew what was going on due to climate, not the providers. Edit 2. I appreciate hearing the responses from those who either had cancer or had a family member with cancer. Just wanted to post a quick reminder that we share their DNA and probably some of their lifestyles as well. Please look out for signs/symptoms and get your testing done. If you don't have insurance, go to an ER. Legally, no one can be turned away. I had a headache, and a few hours later noticed that my irises were different sizes. I went reluctantly to the emergency room. Minutes after presenting myself, I had neurologists looking at me and I was rushed to get scanned. The artery about 1.5 inches below my brain had torn. The DRS were basically just waiting for me to have a stroke. I didn't, somehow. I'm in vet school. I hope this counts. Sometimes we have classmates bringing in their own pets for us to train different techniques. For example, how to handle a pet that is aggressive, a pet that for some reason has to be handled a certain way, or that has X condition so we get to see in class what it's like, etc. This girl brought in her 2 elderly dogs. One of them actually had several health conditions and was blind. The other one was brought along just because they hate being away from each other. Of course we were focused on the dog that had health conditions. But at some moment the healthy one made a weird noise with her throat and the girl went, oh, she does that sometimes. I think it's just allergies or something. Don't worry. The teacher thought it would be a good idea to train auscultation on the healthy dog as well anyways. It was an ugly tracheal collapse. The student hadn't known the signs up until that point, and would never know if our teacher hadn't decided to check anyways out of curiosity. Patients not telling HIV status despite knowing they are positive. When further asked that why didn't they tell us, they say that they thought it's not important. How can HIV not be important? It changes everything. I worked in a path lab. Doc said that the diabetic patient came in saying, I think my foot is infected. 3 hours later he amputated the leg and it landed on a path assistant's table. He made his first cut and audibly gagged at the sight of fucking maggots coming out of the incision. The patient was walking around with bugs eating him from the inside out for more than a week. Totally gross. Saw an old lady as a med student with a broken foot. We were chatting a bit and she mentioned a discoloring on her hand she was only mildly worried about. My supervisor wasn't quite sure what it was, so we asked a dermatologist. Ended up being melanoma. A patient of mine, anesthetics, neglected to tell us that he had a difficult airway. Fortunately we picked up a faded crick scar before induction. A guy with a mild fever said his armpit was really sore, but probably from recoil. He had been out camping and rifle shooting. Then he mentioned that him and a friend had been shooting prairie dogs. Edit, forgot to mention, Northern Arizona. Lymph node biopsy showed G-rods, and bipolar staining with rights. Holy shit. Not exactly an answer, just my experience as a nurse. I had a patient who was on strict input/output, meaning we had to measure everything going in and, coming out. I went to measure his urine output from his urinal and it was dark brown and contained something that looked fibrous. Turns out he'd been using his urinal as a spittoon. Needless to say, I explained what it was really for after a horrified moment. I was working in an area with lots of Mennonites. A mom called into the clinic because a wheel had broken and one of the spokes had penetrated her toddler's eye. The reasons for the call was to ask if he needed to be seen by a doctor. She indicated they had removed the spoke and she knew he was going to lose the eye. So was there really a reason for him to be seen? The answer was yes. I'm a midwife. Had a patient who was 4 days postpartum. She's the kind of person who never complains about anything. When she was in labor she didn't want to go to the hospital yet because it wasn't bad enough. She almost gave birth in the elevator. Anyway, her husband called me and said she had a fever of 39°C for 2 days and he was worried. I had to beg her to come into hospital. She ended up needed 3 days of 4 antibiotics for endometritis. Even the doctor I called to consult didn't believe it at first since she didn't seem to be in pain.